Hey folks, it's Beth Wright, and this is a podcast for Chapter 21, Unit 2, NUR 236. So in this chapter, we're going to be talking about viral infections, specifically hepatitis and HIV and RSV. Medications used to help treat these. So, a virus is a small infection that replicates only inside living cells or other organisms, and it can infect any type of life form, including humans, animals, and plants. And it can spread in many ways. Oftentimes done by insects like mosquitoes. It can also spread through the mucous membrane on contaminated hands. Influenza is an example of where coughing and sneezing it can be transmitted. Norovirus, rotavirus is common examples of gastrointestinal infections. And of course, HIV is an example of a virus through sexual contact or exposure to blood. Another one that's been in the news a lot here lately is the Zika virus. And again, that's, through a mosquito and causing great concern, especially for women who are pregnant. So, we know, that antibiotics do not kill viruses. And, we, have to pretty much treat the symptoms of viruses. The use of antibiotics can actually cause a resistance to build up to the antibiotics. So we got to teach patients, very important to teach patients not to, take antibiotics if they have a virus. There are a few antiviral medications available, but sometimes they're not always effective. Vaccines are our biggest help with many serious viral infections, and if you can think of a few in your mind as far as what are some vaccines available for health promotion. Because that, again, this is something that we can teach our patients about. And of course, one right off is a flu vaccine. Another example is the Gardasil. That's for the HPV, the herpes virus, and the shingles for chickenpox, or for Zoster's Zoster's type of illness, and the chickenpox vaccine is also available. So there's many more out there, and that's something that is important for us to teach patients about, giving them information about that. And of course, vaccines help prevent many infections, so it is one way to combat that, to prevent it. But with minor illnesses, healthcare providers say, if the healthcare provider says it's a viral infection, the best thing to do is treat the symptoms and just let it run its course. And of course, provide teaching for individuals about not taking antibiotics and that kind of thing if it is a virus. So antivirals work, and when we think about how they work, we've got to think first about specific antibiotics, are developed to treat specific bacterial infections, and that is the way it is with antivirals as well. And the thing about antivirals, they do not destroy their target pathogen or virus. Instead, they inhibit their development. This is how antibacterial agents and antiviral agents differ. A virus must have a host to replicate. And so, again, they inhibit their development. So, with just like with folks who develop resistance to antibiotics, they can also develop resistance to antivirals. Difficulties in developing and using antivirals is that viruses are smaller than bacteria, and they are encapsulated with a protective coating, so it makes it difficult for medicines to penetrate through that coating. And it's difficult to treat because of the protective coating, as they are less susceptible to antibiotics. And viruses cannot grow or exist without host cell, so they must be in a living organism to survive. So testing of new drugs to help viruses can be difficult as well. So because there's so few antivirals and the risk of resistance, they're used conservatively. And it's generally important to place emphasis on the use of immunizations to prevent viral infections rather than to use antivirals and risk the chance of resistance. So again, also we focus on symptom management many times with viruses. So types of viruses and antivirals, we have the herpes virus, the herpes simplex virus 1 and 2. 1 is our simple fever blisters, 2 is our genital warts. Then we have the varicella zoster virus, which are shingles. And medicines used for that is the acyclovir. It interferes with the virus DNA replication, and it's used for immunocompromised patients and with the patients with our herpes viruses as well. And again, folks can develop a resistance to this, so try not to use unless we absolutely have to. Renal impaired dosage has to be reduced, so we check that GFR to make sure it's up and before starting this. And adverse effects are going to include headache, malaise, vomiting, diarrhea. Also, IV route can cause site reactions. We have to watch about that, and hives. Confusion, seizure, and coma also. This medication is contraindicated in heart failure and renal disease and lactation. So, the chore there is going to be to get a good history on the patient and make sure there is none of these issues going on, or that they're not breastfeeding. Got to check the liver function and renal function and prevent interactions. We can administer this by mouth or IV, and the IV needs to infuse over an hour and make sure that they're well hydrated. It is a weight-based dose. We got to provide that teaching for the patients and, of course, assess for therapeutic effects. So, if it's somebody with your herpes virus, genital warts, are they doing better with that? If it's fever blisters, are they gone? If it's shingles, are they, decreasing? Are they, experiencing less pain with that? Okay, for the cytomegalovirus, we have the ganciclovir. And notice, guys, these medicines, the generic names end with VIR, and that should be, when you see that at the end of a generic medication, you should think virus. Okay, so ganciclovir inhibits the DNA synthesis and is used for retinitis. Cytomegalovirus is a crazy virus that people with immunosuppression can pick up. People with HIV can pick up, and so also transplant patients as well. PO is for prevention with HIV patients of the cytomegalovirus, because cytomegalovirus can cause blindness. With older adults, we have to adjust the dose with the GFR, checking the GFR to make sure they're not renal impaired. And of course, the adverse effects, chills, fever, pruritus, anorexia, nausea, vomiting. You notice there we've got all of our cells involved: red blood cells, leukopenia, neutropenia, thrombocytopenia. So we got our red blood cells with the anemia, our white blood cells with their leukopenia, neutropenia, and our thrombocytopenia is going to be our platelets. So those kinds of things are going to have to be monitored. Retina and detachment and hematuria, sepsis, and renal issues. Okay, so we got to be watching about that. Our black box warning, bone marrow suppression is important. So again, we're going to be watching all those blood counts with their CBC. And of course, childbearing age should use protection up to 90 days post-treatment. So very important because it's teratogenic. It's contraindicated with neutrophils less than 500 or platelets less than 25,000. Valganciclovir is another medication, and it inhibits the viral replication. It's a PO medicine used for the cytomegalovirus, and the black box warnings are the same. The difference in this medicine is it talks about the importance of taking the medicine with a high-fat diet to help with absorption. Your respiratory syncytial virus, RSV, is a virus causing a lot of respiratory problems with, typically we see this with children, a lot of mucus and problems with breathing, and it can be life-threatening, especially for premature babies and children up to age 2. It's typical cold symptoms in older children and adults is what's seen, but for children 2 and below can be life-threatening. So hospitalization is typically required. Ribavirin is the medicine used for this. It's a synthetic nucleoside antiviral. It inhibits the DNA and RNA replication of this virus. Now this virus is spread by droplets and contacts, so isolation precautions would include droplet and contact as well as standard precautions. Adverse effects of this medicine are fatigue, insomnia, headache, anemia, nausea, anorexia. Rare is hypotension, cardiac arrest, conjunctivitis, bronchospasms, apnea, and decreased respiratory function. And that is why you have patients in the hospital when you give this medicine. Healthcare workers can get sick being exposed to the medicine as well. This is teratogenic, so we got to be careful about anybody giving the medication as well as receiving the medication. It can be administered by inhalation treatment, so we got to have a well ventilated room. And of course we're going to assess for those therapeutic effects, making sure that we are having less mucus, less problems breathing, that kind of thing, and also assess for those adverse effects. Now, influenza type A and B, we have amantadine as one of the medicines for that, as prophylaxis and to treat the flu. However, in the United States, because of resistance to the medication, it's not used very much. This medicine is used to treat Parkinson's. Older adults, we have to watch about renal issues. We have the adverse drug effects there listed, and drug-drug interactions listed as well. Also, Tamivir is a medication that inhibits a native viral enzyme, and it's used to prevent influenza in children. And adverse effects, as you can see, nausea, vomiting, diarrhea, conjunctivitis, and epistaxis, which is nose bleeding. It is contraindicated for breastfeeding females, and it should not be taken 48 hours after receiving a flu vaccine or 2 weeks after. Administer this medication with food. Hepatitis B virus obviously affecting the liver, as all hepatitis viruses do. Lamivudine is your medication for this. It terminates the DNA chain and RNA chain of the virus, and it's HIV RNA as well. So it's used for hepatitis, and it's also used for HIV patients as well. It has side effects of pancreatitis, so we got to be watching for signs and symptoms of that. Also neutropenia, neuropathy, muscle, skeletal pain, headache, cough, insomnia, infections of sinus, nose, ears, and throat. So we got to be watching about all of that. Black box warning with this is lactic acidosis and hepatomegaly with steatorrhea. So when we talk about lactic acidosis, is when there's too much lactic acid that builds up in the bloodstream, and it's building up faster than it can be removed. Lactic acid is what's produced when oxygen levels in the body drop. The causes for this is usually intense exercise, but it obviously can be caused by medicines and other diseases, such as what we're talking about here. Symptoms may include nausea and weakness, so it may be one of those things you know it's subtle that you can't pick up on. So we've got to be watching for that kind of thing, and check your ABGs as well as your lactic acid levels. Types of antivirals for HIV. So antiviral HIV meds are used in combination to help reduce the risk of resistance. And let me tell you, these folks have to take medicines upon medicines. However, they're coming out with new combinations to help reduce the problems with so many medicines, and we call that the pill load. Some of the medicines are taken on an empty stomach, some 2 hours after arising, some at bedtime. So it's definitely a pill burden on the patient. And I had talked with one HIV client one time, and he was telling me it's like 20-some medicines that he has to take all throughout the day. And it's very, very difficult for them to stay compliant, because if they stop taking those medicines, then the virus is going to start replicating and there's going to be problems. A lot of times they won't stay on their regimen, and so should their medicines be used? If they don't stay on the medicines, they can build up resistance to the HIV virus. So it's just definitely controversial, and the costs for these patients are enormous. And so anyway, they do what they have to do. If they do that, really HIV it can be considered a chronic illness, because patients are living much longer with HIV because of the medications that are available out there. So when we do have patients that are taking their medicines, what do we evaluate for therapeutic effects? We got to measure that CD4 count, T cell count, and the viral load. So when someone is diagnosed with HIV before any treatment, they will have a high viral load and a low CD4 T cell count, because that's what's attacked. The CD4 T cells count is attacked by the virus, and so it's low. When they get on their medication, we should see that those numbers reverse. We should see the viral load count low and the CD4 count high, making the virus undetectable. That's our goal in this treatment. So many of the medicines have severe side effects and require hematological monitoring, so we've got to teach the patient about that. The Sidovudine is a nucleoside reverse transcriptase inhibitor, and it's also used to prevent maternal fetal transmission of HIV, as well as used for exposed healthcare workers. The action is it goes into the DNA of the virus and affects needed enzymes for the RNA conversion to DNA. The use in children and neonates is given if mom is HIV positive within 6 to 12 hours of birth, and it needs to be adjusted for renal impaired patients. The adverse effects of this, we have headache, nausea, vomiting, anorexia. Also, black box warning with this, granulocytopenia, aplastic or hemolytic anemia. So aplastic is when no new cells are developing in the bone marrow, so all cells are affected, red blood cells, white blood cells, platelets. Pancytopenia, so again all of our cells are involved. Leukopenia, lymphadenopathy, also lactic acidosis and hepatomegaly, with steatorrhea, and symptomatic myopathy and myositis can occur with this. Liver issues can occur with prolonged use. They can take this medicine with or without food. They should not miss a dose. It will affect the working of how the medicine works. And of course, assessing for therapeutic effects, we're going to monitor the CD count and viral load and for adverse effects. Now, I put a pictogram in there because of the whole antiretrovirals, just to look at, there's different types there, and so patients will be placed on anywhere from 3 to 4 drugs with these medications, okay? So that's for you to look at and help with your studying. Okay, efavirenz is a non-nucleoside reverse transcriptase inhibitor, and it blocks the HIV-1 replication, and it's taken with other antivirals as well. Severe liver disease, it's contraindicated, as well as suicide and pregnancy. So again, think about what you have to monitor here or assess before these patients start their medicines. You can see the adverse effects. CNS is involved. The GU is involved with renal stones, hematuria, fever, fatigue, rash, Stevens-Johnson syndrome, toxic epidermal necrolysis, increased cholesterol, and liver issues. So we need to be watching and monitoring for that. They need to take this at night if the depression is happening, so that they can sleep while that's going on, I guess. They need to take it on an empty stomach. If high-fat diet intake, they need to take it afterwards, and they should not stop this medicine abruptly. They need to be tapered off if they have to stop it. Okay? And we need to teach that they need to not drive because of the dizziness and that kind of thing. They need to not drive until they see how the drug affects them. So teach. We got to teach the patients about this. Saquinavir is a protease inhibitor. It affects at a different life cycle of the HIV virus, and again, side effects galore. We got the cardiac, both blood pressure, hyper or hypotension, chest pain. With the CNS system, we can have, again, the suicide issues, back pain, fatigue, neuropathy, dermatological. We can have pruritus, rash, or eczema, and of course, hematological. Look at all that being involved. All the cells are going to be involved. When you see pancytopenia, pan meaning all, that means they all risk being low. So we got to do checks on that, and of course liver enzymes as well. Take a look at your contraindications there. Anybody with an acquired prolonged QT interval or an AV block, hepatic impairment, hypokalemia, or hypomagnesemia. Obviously, we're going to have to do some work here before the patients are started on this, such as an EKG, liver test, and electrolytes. And of course, administration, we want to monitor for side effects that can occur, and that would be with an EKG, liver panel, and electrolytes. Maraviroc is a CCR5 antagonist. Blocks receptor sites to cells, preventing HIV to enter the cells. And so, again, our adverse effects, are many, and we have to be watching for that. It has a black box warning about hepatotoxicity following a month of treatment. So what are we going to be checking frequently? Liver enzymes. It is contraindicated with renal impaired, and meds that are potent CYP3A4 inhibitors. So we got to be watching about medicines that affect the enzymes, and what that is a liver enzyme. So we got to be watching about those meds. And administration is high-fat foods enhance the absorption. So we don't typically see that with medicines. If anything, it messes with the absorption, but with this medicine, it does help with absorption. We're going to watch for or assess for therapeutic effects and adverse effects. Is the patient feeling better? Is their strength better? What's their viral load? What's their CD4 count, T cell count? And we want to teach about changing positions, slow because of dizziness, and report any kind of rash, jaundice, muscle pain, issues with depression as well, muscle pain, and fatigue. So you have a practice question here. Nurse caring for HIV positive client knows the patient understood teaching related to antiviral medications when the patient states. Okay, so this is your favorite. Select all of apply. Okay, so knowing what you know about the whole regimen of HIV therapy. Think about that. Okay, So A, I have my cell phone set to send me reminders about my medications. Do you think that would be helpful for a patient who has to take 20-some pills a day? Absolutely. B, I will keep my medications with me at all times. Okay, would that be a good thing for a patient who have to take 20-some pills all day long, all night long, at different times? Probably so. C, I will stop my medication and notify my physician if I have any weight loss. Okay, is weight loss a reason to stop the medication? Do you remember that being an issue? Now, certainly that can be an issue with this disease process, and it can be an issue for medications. But does that warrant stopping the medication? So hopefully you said no. D, I will double my dose at the next regular scheduled time if I miss a dose. No, they can't miss a dose. They don't need to miss a dose because it is going to mess with the way the antiviral works. Okay, so that's why we want to set the phone to send them reminders. And then E, I will have my lab work done each week when I go to the grocery store. Okay, yeah, that's a good thing because we got to get CBC done to check, your red blood cell, white blood cell platelets. We got to get liver test done, renal test done on specific ones. So yeah, blood work is going to be very important to get done. Okay, this concludes your podcast for Chapter 21.